Good afternoon. Thank you for joining us for the Government of Newfoundland and Labrador's COVID-19 update for today, Tuesday, February 9th, 2021. To my communications director, I'm sure, but I want to speak to each and every Newfoundlander and Labradorian who's experiencing fear and anxiety with the recent outbreak in Mount Pearl. The fear and anxiety is normal in this situation, but we have been here before. The public health experts have led us through outbreaks in Deer Lake, outbreaks in Harbour Breton, and even if you think back, believe it or not, almost a year ago, to the Calls cluster. Together, my friends, we will get through this one as well. And I want to talk directly to the educators, the parents, the teachers, and in particular, to the teenagers and students most impacted by this outbreak. I know you have fears and anxieties as well. Me and my family share those anxieties and fears. Last night, in fact, we sat around discussing COVID-19 and what it meant for schools and their extracurricular activities, and we shared the same uncertainty and fear that I'm sure many of you are feeling right now. And I will tell them what I told you. I will tell you what I told them as we were working our way through all of this. We have to have faith that we'll get through it. Trust in our public health officials and follow their advice. We will come through the other side of this. But you need to do your part. You need to follow the rules, social distance, wear a mask, wash your hands, and please, if you have symptoms or are contacted, please get a test. And if in the unlikely outcome that you're positive, that's okay. We'll get through that too. But please don't bully or harass others that may be positive. We know we can get through this. We have the tools. We have a year of information now that Dr. Fitzgerald and her team have at their fingertips that we didn't before. So although the fears are warranted and sometimes necessary, and I share them too, I'm not with me and my family, but we will together get through this. So together, let's move forward, take a deep breath, and continue to follow public health advice and guidance. With that, I'll pass it over to Dr. Fitzgerald for an update.
Thank you, Premier. Good afternoon, everyone. Thank you for joining. Since the media advisory yesterday, we have 30 new cases of COVID-19 in our province. All are in Eastern Health Region. We have 14 under the age of 20, 2 between 20 and 39, 5 between 40 and 49, 6 between 50 and 59, 1 between 60 and 69, and 2 over 70. We know that some of these cases are linked to previously identified cases, while others are still under investigation. We can now say with certainty that we have community transmission in the metro region, and we will inevitably see more cases in the coming days. The total number of cases in our province is 457, and there have been no new recoveries since yesterday, leaving 57 active cases in the province. In total, we have tested 83,360 people. I know that there's a great deal of fear and anxiety right now, particularly among parents and teachers. Based on Eastern Health's investigation, schools with high school grade levels in the metro area are closed for at least 2 days, while contact tracing is underway. At this point, we have not found any positive cases in other schools. Jurisdictions across the world have grappled with the decision on when to open and close schools during the pandemic. Schools are more than just places of learning. For vulnerable children and children with unique needs, closing schools can have significant negative impacts. For this reason, it is not a decision that we make lightly. We carefully assess the epidemiology and level of risk in order to determine school closures, and we are working closely with the school district in this regard. We are not in uncharted waters. We have been here before, and we have learned so much more about the virus, about how it is transmitted, and how to protect ourselves from it. The lessons of other jurisdictions have armed us with the evidence we need to make informed decisions. What we don't know is what each day will bring. Whatever that may be, our response will be proportional to the risk at hand. Our first course of action is to put more restrictions in place when there is an increased risk of transmission. We are therefore implementing a 2-week circuit breaker to slow the spread of the virus. Effective midnight tonight, I'm implementing a modified special measures order for the St. John's metro area. This will be reevaluated in 2 weeks, and we will determine at that time if it continues beyond the 2-week period. Gatherings that are run by a recognized business or organization are limited to 20 people, as long as physical distancing can be maintained. This includes gatherings at funerals, burials, weddings, and faith-based organizations. Limited visitation is permitted for funerals, provided physical distancing may be maintained with individuals outside of the household bubble. Wakes are prohibited. Gatherings that are not run by a recognized business or organization, such as a family event, must be limited to your household bubble. If you are in a single-person household bubble, you may join with one other household. Group and team sport and recreation activities are suspended. Group arts and cultural activities are suspended, including bands, choirs, dance, and music classes. Gyms and fitness facilities, yoga studios, tennis and squash facilities, arenas, dance studios, and performance spaces will be closed. Outdoor activities, including walking, hiking, or snowshoeing, are encouraged as long as physical distancing can be maintained between household bubbles and you are not required to self-isolate in any way. Outdoor playgrounds will remain open. Retail stores, including those in shopping malls, can remain open in accordance with provincial guidelines. Personal service establishments can remain open in accordance with guidelines. Animal grooming facilities can remain open. Restaurants can remain open at 50% capacity, provided that physical distancing can be maintained between patrons at tables, and buffets remain prohibited. Bars, lounges, bingo halls, and cinemas will be closed. If you can work from home, you should make arrangements to do so. If your job requires close contact with other individuals, and particularly if you're in the food service industry, please wear a non-medical mask of at least 2 layers. A face shield is not an adequate substitute for a mask and does not provide effective protection for yourself and others against COVID. Wash your hands or use hand sanitizer when you begin work and after touching any common surfaces. And do not go to work if you are unwell, even if your symptoms are mild. Stay home until 24 hours after your symptoms have passed. While travelers entering our province have the benefit of time to plan for self-isolation, there are a significant number of individuals in the metro area right now that may be learning what it entails for the first time. If you have been contacted by public health and identified as a close contact of a positive case, you must follow the advice you were given on self-isolation. As a reminder, anyone identified as a close contact and instructed to self-isolate should be separated from the rest of the family completely. They must have their own room with access to a bathroom that no one else uses, and they must not enter shared spaces of the home. Meals must be delivered to them, and if this is not possible within your home and they cannot isolate in another location, then the whole family will have to isolate together for a full 14 days. If you have a symptom of COVID-19, please use our online assessment referral tool to arrange for a test. It is vital that we know of every case of COVID-19 in order to contain the virus. A mild cough or a fever is enough to warrant a test. You should also get tested if you have 2 or more of the following: headache, sore throat, painful swallowing, runny nose, diarrhea, loss of sense of smell or taste, unexplained loss of appetite, and small red or purple spots on the hands or feet. As a recap, for those who may have just joined us, we have 30 new cases since yesterday's media advisory, and the total number of cases in the province stands at 457. Reversing community spread is possible. We have seen other jurisdictions successfully combat it. We will need everyone's cooperation and perseverance to make it happen. Every action counts now. So hold fast, Newfoundland and Labrador, and thank you.
Well, thank you, Dr. Fitzgerald. I'll now open it up to Minister Haggie for some comments.
Thank you very much, Premier. Day 339, and it's a bit like deja vu all over again, unfortunately. Not only are we seeing the second highest daily total since the cluster at the funeral home, but the anxiety and the fear and the worry that goes with that has returned too. And all of those, as you mentioned, are quite understandable. I think it really is important, though, to emphasize that the fact that our numbers are up indicates that testing is finding these individuals. It is really important because we can't manage this pandemic without identifying cases and advising them how best to manage their problem. We can't just hide and wish this away simply with isolation. We have a superb public health team and a superb set of contact tracers, and I've said many times how good they have been in comparison with other jurisdictions, as well as in absolute terms. They managed the funeral home cluster at a time when coronavirus was really totally unknown. They have seasoned and matured since then, and we have been able to draft back again experienced medical officers of health, public health nurses, and trained contact tracers to add to the resources of Eastern Health to deal with the contact tracing that this vigorous testing will generate. And on the testing front, we have significantly more testing capacity now than I would argue we did in March and April of 2020. We have resources that we can bring in terms of more kit and different rapid testing equipment that we have yet to deploy, and that will be done on the advice of public health. We did it once before, and we can do it again, as Dr. Fitzgerald has said. It will take longer than we would like, and there will be ups and downs along the way. But we have some clear guidance from evidence and from public health sources. This is informed, it's sound, and it has worked before. It has worked here. It has worked in other jurisdictions. So to paraphrase the Premier, I think we need to keep the faith and follow the guidelines as Dr. Fitzgerald has outlined. For those teens who may be in a situation they never expected, anxiety is common. It's normal, as the Premier said, and fear goes with that. And when you are frightened and anxious, it's very difficult to see your way clear as to how things will progress. We have one of the most sophisticated and comprehensive suite of online mental health tools for youth and for adults of any jurisdiction in Canada. Bridge the Gap, that's 2ps.ca, has a special area for youth with modules and advice on how to cope with anxiety, how to cope with stress and uncertainty, and how to deal with the situation of anxiousness that you find yourself in. All those emotions are perfectly normal, and they will pass. And as time goes by and the situation improves, I think you will find them of great benefit. The advice there from Dr. Fitzgerald is crystal clear, and I would urge you all to follow it. It was by your hard work and efforts in doing just that that we brought the initial wave under control. We dealt with the spikes that we saw in the mid-fall, and we'll deal with this again. So I think with that, Premier, I'll pass the microphone back to yourself for the rest of the briefing.
Well, thank you, Dr. Haggie. I'd like to now open it up to questions from the media.
Thank you, Premier. For the benefit of our speakers, there are 7 reporters registered for today's call. The question and answer session will be conducted in 2 rounds, where each reporter will have the opportunity to ask 1 question and 1 follow-up per round. Following this, I will ask each reporter if they have 1 final question. Our first questions are from Meg Roberts with CBC. Please go ahead.
I'm just wondering what the relationship is like between the cases. How is the virus being spread? Is it workplaces, homes, recreational activities?
So right now it appears to be certainly with close contact. We are seeing some with recreational activities and certainly within homes. But, still very early days.
I know a lot of parents didn't send their children to school today. why not shut down all the schools, considering that families who have grade school children living in the same household as high school children?
So, we have to go by the epidemiology and the evidence, and we have to make decisions based on what we have in front of us. Right now, it appears that most of the cases are within one school, and certainly there's a lot of contact tracing going on, and we are following that closely. But again, we are evaluating this constantly. And we are in contact with the school board, or school district, on a regular basis. And, we will make decisions. If the evidence changes in any way, we'll make decisions based on that evidence. So it's evolving.
Thank you very much.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
In saying that you're doing this based on decisions, and that's as to why not all schools are closed, but yet we've put in special measure orders to limit contact and to limit interaction. Many of the students that go to high school have siblings or their parents interact elsewhere. So in saying based on evidence would show that contact tracing is going to lead to other schools.
So that may be the case, and if that is, then, we have shut down high schools in the area in anticipation of that. Certainly what we're seeing right now is that the cases are in, nearly half the cases right now are in the new cases, are in that age group for high school. As the information changes, we may have to change our response with that. But we are trying to reduce spread through the community as a way, if we keep our community safe, we can keep our schools safe. So that's the reason why we're doing that, trying to reduce contacts in the community, because we want to try to keep the schools as safe as we can.
A lot of businesses have garnered on their own advice, I suppose, to shut down temporarily or move to other ways of working. As you go through the contact tracing process and how large this is escalated, do you find that not everybody's being truthful through the contact tracing process?
I think for the most part, people are truthful. I think, our contact tracers are quite skilled. They are non-judgmental. Their goal when they get a case is to find every possible contact and potential case that could be associated with that person in front of them. And that's their goal, is to find that out. So, at that point, it's irrelevant if people have done things that they're not supposed to do. Our goal at that point is to reduce the potential harms as much as we can moving forward. So, but for the most part, I think people have been honest once they have tested positive.
Thank you.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
Good afternoon. Excuse me. I'm wondering if you can respond to whether or not there's any investigation going on with respect to large informal gatherings by teens in this particular outbreak?
So any gathering or any event that a case attended will certainly be investigated. And if that came to light, that there was an informal gathering that was attended, then certainly, public health's job would be to do contact tracing throughout that event. So that would be part of the routine contact tracing process.
Okay, thank you. And this may be perhaps for the Minister or Premier. Despite there not being a closure of other schools, it appears that many parents are deciding to keep their children out of the lower grade schools as well. What effect will that have on the ability to provide education? And are there any contingency plans that you're aware of?
There has always been a contingency plan for this scenario, and switching to online learning for all grades was incorporated into into the back-to-school plan. And so if you remember, I know it seems like an eternity ago now, but in September, there was options available for parents who didn't feel safe, or for children with special issues, that they could avail of online learning. And we are hopeful that if the schools, hopefully that the evidence continues to go in the right direction, and we're able to keep those elementary and junior high schools open. But if not, there is a contingency plan in place.
Thank you.
Our next questions are from Sarah Smelly with the Canadian Press. Please go ahead.
Hi there. I'm wondering, given a bit of a step up in the situation today, where does this leave the election? Are there discussions about postponing it, anything like that?
Well, Mr. Chalk is the Chief Electoral Officer for Newfoundland and Labrador. I understand, is monitoring the situation, and certainly has planned for different scenarios in a COVID-19 election, which is what we are in. And I have faith in him and the public health officials that we can continue to navigate this in a safe and effective manner.
And Premier Furey, what is your role in these discussions right now, given that we are in a campaign and things, the House was dissolved? What is your role in determining and in making decisions about public health protocols, things like that right now?
Well, certainly I do not have a role in making decisions on public health. As we stated at the beginning of this election, that we would continue to talk with Dr. Fitzgerald and her team for daily updates, and we have. But since taking over in August, the relationship hasn't changed. Dr. Fitzgerald and her team make decisions based on science, based on evidence, and sometimes evidence and science changes, by the way, as this virus evolves. But they've done a great job so far, and I have every confidence in them and their team to lead us through this outbreak as well.
Thank you.
Our next questions are from Patrick Butler with Radio Canada. Please go ahead.
First of all, Dr. Fitzgerald, do we have any other information on the source of these outbreaks?
No, at this time we don't have any information on the source. As you can imagine, with the number of contacts that public health is having to deal with at this time, our focus is really on the contact tracing and finding as many cases as we can. Once we feel that we have been successful at that, we have people in isolation and have better control of things, and really understand what's happening with this outbreak, then there'll be time to sit down and really do an in-depth evaluation of possible sources and things like that. But at the moment, we're such early days. Our focus right now is to isolate, test, trace, isolate, and test, basically.
And I understand that the decision on any changes to an election date or anything like that comes down to Mr. Chalk, the Commissioner of Elections, but he said repeatedly that he's going to base his decision on what public health recommends. I understand, Dr. Fitzgerald, you're meeting with him after this briefing. Are you going to tell him, would it be your recommendation to make any changes to the date of the election, given what you have just announced?
So I don't think it would be appropriate for me to talk about that right now before talking to him in a meeting. So, but we are having conversations about it.
Our next questions are from Elizabeth Whitten with All Newfoundland Labrador. Please go ahead.
Thank you. Dr. Fitzgerald, yesterday you said the number of people self-isolating was in the high hundreds, and I'm curious if you have an updated number right now.
So it is, I don't have a definitive number. We are talking right now somewhere between probably 1,200 and 1,500 people.
Thank you. And I was wondering if you could provide more information on the three three clusters, like how many cases are linked per cluster?
So I don't have that breakdown right now. It's still, as I said, still very early days, and Eastern Health is just trying to trace as many contacts as they can at this point. But as time goes on, we will have more information related to that, for sure.
Thank you.
Our next questions are from Linda Swain with VOCM. Please go ahead.
Hi, good afternoon. How many tests have been administered since the first St. John's cluster was identified, and do we have enough tests?
Sorry, Janice.
No, I was going to say, I don't know that we have the exact number of tests that have been administered since then, but yes, there's no issue with the number of tests. We have enough tests to be able to do what we need to do.
I was just going to add, Linda, that in terms of the number of tests rather than the number of people tested, when the number of people tested reached 80,000, we actually had passed the 100,000 test mark on the PCR machine. With regards, for example, to the rapid testing kits that were deployed in this current outbreak, we have over 100,000 kits in stock.
Thanks. And what about rapid tests? I know rapid tests were just mentioned off the top there and ready to deploy, but will they be used here like they were in the Harbour Breton area?
We have used rapid testing here already. Not quite the same test as what was used in the Harbour Breton outbreak. We're using a rapid antigen test here to help us identify potential positive cases more quickly. So far it's been quite successful.
Our next questions are from Meg Roberts with BBC. Please go ahead.
Premier Furey and Dr. Haggie, what is it about the situation of the last 2 days that made you both want to leave the campaign trail to be at these briefings, and what should people read into that?
Well, I think, the gravity of the raw numbers is certainly something that everyone should take serious. And I think the fact that myself and Minister Haggie have stopped campaigning and have gone back to work on COVID-19 it reveals the seriousness and the significance of it. And we also have heard, and I have heard loud and clear, that there are real anxieties out there, and we want to make sure that we're here to help people get through this, to provide whatever assistance we can, and to support Dr. Fitzgerald and her team.
Some people are nervous about going to the polls. How risky is it compared to other activities, such as going to the grocery store?
We could probably all answer that, but
yeah. At this point, when you look at, we need to go back to our people, space, time, and place, right? So if we're practicing, if we're following those measures, that we're interacting with as few people as possible, if we are spending short periods of time inside with them, then, the risk is lower. If we're wearing our masks, the risk is lower again. If we're washing our hands carefully, the risk is lower again. So, there are ways that these things can be done safely. And I think that people need to remember that. And if you're trying to compare the risk to, say, going to a grocery store, I think in a polling station that's well run, that is paying close attention to the rules and ensuring that there's physical distancing and lots of hand sanitizer around, and that people are wearing their masks, I think you're not looking at any higher risk in that situation.
Thank you very much.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. Mr. Furey, you just said that you've left the campaign trail as well as Minister Haggie to bring light to how severe this situation is, yet we are still expected to go to the polls on Saturday. Is it still your recommendation that an election should be held right now?
Well, Kellyanne, as you know, I'm running in an election, but I don't run the election. Mr. Chalk has been fully equipped and has told us he's been equipped to deal with COVID-19. The two are not, because there's a serious situation does not mean that we cannot run a safe and effective election. We've seen safe and effective elections in other jurisdictions around the country and in other countries with a greater burden of disease than we currently have. that doesn't diminish the significance of people's anxieties and fears with respect to this current Mount Pearl cluster. And that's why I'm here today.
As much as I would love to spend time on the election, the kids that have tested positive recently, those teachers in schools, we're now hearing of other schools. Are those teachers being advised to self-isolate?
Sorry, Kellyanne, can you repeat that?
Sorry, I'm having a lot of teachers ask if kids are sick, should staff in those schools be isolating? Some of them are finding out about positive cases within their school, whether they're from the weekend or previous to that. So should teachers be isolating as well if they're aware of positive cases?
So if you are identified as a contact of a positive case, public health will let you know and they will advise you about isolation. If you've been advised through the district that, your school should in the event that, people in your school should self-isolate, I think public health will be communicating and collaborating with the district to provide the advice for that. So at this point, what we're telling people is if you have symptoms and you have to get tested for COVID-19, obviously you need to self-isolate until you get a negative test and your symptoms resolve. If you're positive, of course, public health will contact you and will advise you of how you have to isolate. If you have been advised to get testing by public health, then in general you will isolate until you get a negative test back if you do not have symptoms. However, there are some exceptions to that, such as some of those people that we advised in the restaurant advisory there just recently over the weekend.
Thank you.
Our next questions are from Peter Jackson with the Telegram. Please go ahead.
Hi, sorry about that. I'm wondering whether any reinforcements have been brought in yet to help with contact tracing.
Yes, so certainly, the Eastern Health has gotten support from other regional health authorities where they have capacity for contact tracing, and we have other contingency plans in place that are being put in place at the moment to help support Eastern Health in their contact tracing and contact follow-up.
Okay, thank you. And Premier, with regards to the election, a number of people have said that basically you were foisting the decision to allow this election off on the Chief Electoral Officer. But did you entertain or discuss any other scenarios at the time that the election was called?
Well, first of all, in a writ period, the decision does lie with him. I'm not sloughing it off or trying to delegate it to someone else. It is his decision. That's the democratic process. When we evaluated the decision to have an election, the numbers were very low, but we knew that we were in a COVID-19 scenario. We were informed that by his office that he was ready for a COVID-19 election, and there had to be an election in 2021. He knew that. He knew that COVID wasn't going away in 2021. So presumably he has taken the utmost measures to ensure that we can navigate this, which is, albeit scary, but albeit predictable to a certain degree, scenario where there would be an outbreak which would have to be dealt with respect to operating an election. And I'm assuming that he has spoken with other chief electoral officers across the country and in other jurisdictions to get guidance and best evidence, along with collaborating with Dr. Fitzgerald and her team.
Thank you.
Our next questions are from Sarah Smelly with the Canadian Press. Please go ahead.
Hi there. What do you say to claims that during an election campaign, Premier Furey and Minister Haggie, that you're taking part in these public briefings is politically inappropriate and gives you a bit of an advantage?
I don't think that this gives anyone an advantage. Being in a caretaker government scenario, the Premier is still the Premier, the Minister is still the Minister, and these are higher numbers than we're used to, and we recognize the significance and seriousness of it. Also recognize what an impact it has on the families and the uncertainty, and as a result, no different if there was other issues facing government that were pertinent, that needed different ministers or the Premier to voice or lend a voice to. That's why we're here. It's not being political whatsoever. I mean, we've parked the political aspect, and this is being a Premier.
Okay. And I know you were asked this yesterday, but given that things are a little different now today.
Look, as I said yesterday, you make decisions with the evidence available to you at the time. The numbers were low, and they had been low for quite some time. And we were given assurance COVID-19 election could happen. It had to be an election in 2021. I mean, that's the law. It's not my law, but it is the law. And I said I would follow the law, which we should follow. So there had to be an election in 2021. By definition, there was going to be a COVID-style election, whether it was now, October, July. We were going to have to deal with COVID-related issues in an election cycle. Is it ideal? No, but I didn't create that scenario. I was making a judgment at the time based on the numbers and looking at trying to look into the future as best I could. But no one has a crystal ball and is clairvoyant when it comes to COVID-19. And you make the decisions with the evidence available to you at the time, but knowing that there had to be a COVID-19 election this year.
Okay, thank you.
Our next questions are from Patrick Butler with Radio Canada. Please go ahead.
Dr. Fitzgerald, the last time we saw around 30 cases announced in one day was at the end of March when we were dealing with the calls cluster. There were eventually 175 cases related to that incident. Is that where we're headed? Where we're talking about community transition at this point?
Yeah, it was March 25th. I remember it very clearly. That is the likely scenario in this case. We are just a few days into this right now, and we're already seeing 30 cases. So it is a reflection, however, of the amount of testing that we're doing and the contact tracing that we're doing. The people that we're finding are people that we're looking for, like we're expecting to find them. So that's a good thing. It's better to find 30 cases than to not find them. So this is a reflection of public health doing its job. We have to remember that as well. It doesn't mean that we can let our guard down. It doesn't mean that we can't be careful or that we shouldn't be careful. But this is what we would expect if we're doing contact tracing and looking for those people who have been in contact with positive cases.
And a question for the Premier. Premier, in the last election, we had a riding that was decided by 2 votes. In Labrador West, it came down to a judicial recount. There are now 1,200 to 1,500 people in isolation across 16 of 40 ridings in the province. Given that, is it appropriate to hold an election on this Saturday?
Well, I mean, Mr. Chalk is looking at all tools available to him right now to ensure the franchise is protected for everybody. Again, I was told at the beginning that he had all the tools he needed to run a COVID-19 election, and he has many tools available to him. Once the writ is dropped, it's his decision to navigate the election. And I think it's prudent and responsible and democratic for him to be the one making these calls. Can you imagine if there was a different circumstance in which there was an election and then I tried, or whoever the Premier was or any leader was, to try to intervene to disrupt the election in one way or the other? It wouldn't be right. Mr. Chalk has the tools he needs, and I have every confidence that he'll make the right decisions moving forward.
Our next questions are from Elizabeth Whitten with All Newfoundland and Labrador. Please go ahead.
Thank you. How many of the recent tests have been sent to the National Microbiology Lab to get checked for COVID-19 variants?
So we send most of our tests up to the lab. I don't have a definitive number at this point, Elizabeth.
Okay, I was just curious if the spike in cases, is that a concern that we may have a variant that is highly contagious and spreads easier?
So, you know, we behave as if right now we have the variant. That's just kind of the mindset we have to go with. We haven't to date had any cases of the variant here. And the spread that we're seeing is not in keeping with what we've heard to be, typical for the variants. So we have certainly sent specimens related to this outbreak to the National Microbiology Lab for further assessment, but I just don't have the exact number. I'm sorry.
Thank you. I'm going to count that as one question. Health Canada has approved Pfizer's request for each vial that contains 6 doses instead of 5. And what does that mean for our efforts to get all Newfoundlanders and Labradorians vaccinated?
So, you know, that means we're certainly we have to make sure that we have the right tools to do that, and you do need the right syringe to be able to do that. And we're working with the federal government right now to make sure that we can procure those. And we have been able to get 6 doses out of the vials, 50 to 60% of the time. So. It's something we're working on, and I guess as time goes on, we'll see what the impact will be.
Thank you. Our next questions are from Linda Swain, VOCM. Please go ahead.
Hi, this one's for the Premier. We're hearing from a growing number of people who say they simply don't want to take the risk to go out and vote. Is public disenfranchisement a concern?
Well, I think they need to follow Dr. Fitzgerald's advice, as she suggested in a previous answer. Going to a grocery store, which is an essential element of life, is about the same risk profile as going to vote when the polling stations are set up appropriately. So now more than ever, the province needs a stable government to help navigate these uncertain times. And I encourage everybody to exercise their right to vote, regardless of numbers or pandemic, because I'm confident that Mr. Chalk will have the tools he needs to ensure that franchise is protected in a safe and sound way.
This question is for Dr. Fitzgerald. I know you don't address rumor-based questions, but the rumor mill has been on bust. Can you address some of the things widely shared in the public realm and the impact that has on individuals and the community as a whole?
Oh, I'm sorry, you're breaking up there. I didn't hear your question at all.
Can you address some of the things being widely shared in the public realm and the impact that has had on individuals and the community as a whole?
Some of the rumors towards the community as a whole?
Yes.
You're difficult to hear, Linda. Was it surrounding the rumors and the impact on the community as a whole?
Yes, people have been saying all kinds of things on social media. I have people telling me all the time, I heard from somebody who heard from somebody who heard from somebody that these things were happening and have been happening. What kind of an impact does that have when people are sharing that kind of information?
Yeah, I mean, it can be significant. Thanks, Linda. Sorry, it was really hard to hear what you were saying. It can be quite significant. It can serve to increase anxiety, and sometimes it's not even factually correct. So, as we've always done, we encourage people to get their information from credible sources and rely on public health, the Public Health Agency of Canada, the government, our government Newfoundland and Labrador's website, the Public Health Agency's website, the World Health Organization. These are all reliable sources for information. Certainly, we in public health have been as transparent as we can with regard to cases and risks and what's happening in the community. It's not in anyone's best interest for us to be holding back on that. So People need to understand that they can trust what's being said and by the public health officials. And, you know, if you're looking at social media, you do need to make sure that the information is coming from a trusted site.
Thank you. I will now go back through each reporter to see if you have one final question. Meg Roberts with CBC, do you have a final question?
Yes, I do. Just to be clear, should people in the metro area be traveling to other areas of the province? And if you could just go over the protocols for bubbles one more time.
So, you know, certainly I think travel should be essential if possible. And, you know, understanding that, you know, people have to go to work, people may have to come for medical appointments, there may be other reasons, essential reasons that people have to come into the city. But we would encourage people, you know, to limit their travel to essential reasons. And with regard to bubbles, so right now what we're saying is that informal gatherings should be, if you're going to be doing anything, you really need to limit it to your household bubble. If you are a single person in a household bubble, you can combine with one other household. You know, we're trying to be cognizant of mental health and the importance of being able to have somebody to talk to or to lean on as necessary.
Thank you.
Kellyanne Roberts with NTV, do you have a final question?
I do. Given the spiking cases today and the fact that Premier Furey and Minister Haggie, you've left the campaign trail to address this, Premier Furey, how come you weren't at the all-party committee this morning and numbers can be informed to the all-party committee?
Pardon me on the last part, Kellyanne?
How come you weren't present at the all-party committee this morning, given the severity of the situation today, and knowing that, or that numbers also weren't relayed to the party?
Sure. Two points. First of all, I was there yesterday and will be there tomorrow on the all-party committee. We had a previously scheduled event that we couldn't shift or moved. And with respect to the numbers were still coming in and not accurate up until almost the moment we walked in the room here a couple of minutes ago. So my understanding, and Minister Haggie, you can chime in here, but that the all-party committee was told of numbers, but that not exact numbers per se, because frankly, it wouldn't have been accurate as the numbers were coming in real time, and as Dr. Fitzgerald said, this situation is evolving.
So just to be clear, Kellyanne, I was very cautious to avoid the situation where I misspoke and provided an incorrect number. The issue this morning was that we had two reporting lines of positive tests. We had one coming in through the PanBio line, the rapid antigen test, and independently we were having the PCR runs come off the public health lab. So we had two lists and they were not yet reconciled. So I didn't want to undercount or double count. And I made it quite plain the reason why I couldn't provide the number. And, you know, I said that the process was new because we had not run this process in the past with two parallel lines of numbers. You're damned if you do and you're damned if you don't. If you give them the numbers and they're wrong, you're told off for being wrong. And if you don't give them the numbers, you're hiding something. And really and honestly, that's disingenuous.
Thank you.
Peter Jackson with the Telegram, do you have a final question?
I do, Premier Furey. I'm loath to belabor the point, but by June or July of this year, more vaccines will have been administered. Children will be out of school. People will not be inside as much. So for plenty of scientific reasons, it seems it would have made more sense to hold the election later than sooner. Can you explain why you picked February?
Well, some of the probabilistic modeling that we saw spikes actually later than in the year than where we are right now. And as I said from the beginning, like I never took this decision lightly. We looked at the numbers and where we thought we were going to be, but no one is clairvoyant. As you can see with respect to the even distribution in the supply chain of the vaccine, it's not as robust as we would have thought. and predictability about who and when people will get vaccinated is getting more certain, but isn't certain. So, there's no great time to have an election. I mean, that's the bottom line. And this was always going to be a COVID-19 election. There's nothing I could do about that, and that's the law. There is nothing I could have done about that. I chose a time when I thought the cases were low. And just with respect to a lot of the cases right now are in schools, and that's terrible. But in June, we wouldn't have reached herd immunity by June. That's not what anyone has ever said. So we could have been dealing with this very scenario of an outbreak in a senior high school in September, because as we know, the vaccine for some of these individuals that have been involved, they'd be a lower priority on the list. So there's never a great time to have an election, and that's the bottom line. But it wasn't necessarily all up to me. This was the law. We had to have a COVID-19 election, and now we're into it.
Thanks.
Sarah Smelly with the Canadian Press. You have a final question?
I do. Thank you. Premier Furey, given that you don't see your attendance at these briefings as political or politically advantageous, will you be extending the same opportunity to Ches Crosby and Alison Coffin to attend one of these briefings and address the public?
Well, they are available to address the public throughout the campaign, through the media outlets all the time. This is a caretaker moment in our province's history. And as Premier and as Minister of Health, when an episode like this occurs, you need the Premier and the Minister. And right now, I'm the Premier and Minister Haggie is the Minister, and that's why we're here. It's not political, and it's just operational.
Okay, thank you.
Patrick Butler with Radio Canada. Do you have a final question?
I do. I'd just like to pick up on Peter Jackson's question again. Premier, you said that there's nothing you could have done, and that I understand that not everybody would have been vaccinated later in the year, but more people would have been vaccinated later in the year. And so, I got to ask you again, given that undeniable fact, do you still say that you don't regret calling the election when you did, given the announcement that we got today?
Look, we were, I told you from the very beginning, this was not a decision that I took lightly. We looked at the numbers, and we tried to predict the future as best we can. That's how you make decisions. You look at the evidence available to you, and you try to look forward as best you can. The numbers were low. The probabilistic modeling looked like we may have a spike more towards the end of March. And so we thought the time was now. There's always going to be a question around election timing. That's just the nature of this business. There had to be a COVID-19 election. Mr. Chalk told me that told the office that we were ready for a COVID-19 election because there has to be one. I mean, he knew as soon as I was sworn in August that there had to be a COVID-19 election, and he's been preparing ever since. In combination with discussions with public health, we thought that this was the best time.
Thank you.
Elizabeth Witt with All Newfoundland Labrador. Do you have a final question?
Yes, I do. At the top, Dr. Fitzgerald, you said people who can work from home should, which is the public health advice we've gone from the beginning since March. So I'm wondering, is there something different about now in this advice? And does it mean government employees will be working from home now?
No, we've said from the beginning that if you could work from home, you should. That hasn't changed. I think we're just making it, we're bringing it out to the forefront again, just as a way for people to reduce their contacts, which is the most important thing that we can do here, is to try to reduce contacts as much as possible, where you can still do what you need to do every day. Obviously, there are people who will not be able to work from home, and there will be situations where people will have to go to work or school or whatever the case to be able to do what they have to do. But where you can, then we should all try to do that. Again, as a community, to reduce the risk for the community, to make those people who have to go to work and have to be on the front lines to make the community safer for them. So that's the reason why we recommend that.
Thank you. Linda Swain with BOCM, do you have a final question?
I do. With 41 new cases in 2 days and more inevitable, at what point do we see a change in alert level?
So as we've said, since we've started, since we got to level 2, really, I guess we thought that we would apply restrictions on a regional basis or on a localized basis, and that we would apply them in response to where we felt the risks were. So we're trying to really tailor the response as much as we can. So I'm not sure really that it makes sense to go back up alert levels when we get to when we encounter situations like we're seeing right now. What we're trying to do is give a localized, contextualized response so that we can reduce the risk as much as possible while minimizing the societal disruption as much as possible. That's our goal here.
Thank you.
Thank you, everyone. Premier, do you have any final comments today?
Well, thank you all for joining us today. I'd like to end where I began by asking everyone to stay calm, follow the public health advice. It's gotten us through other outbreaks, and it will get us through this one. But each and every one of you has worked hard to get us where we have been to date, and we need to work hard, dig deep for a little bit longer. If you have symptoms, call 811. If you, please be honest with your symptoms, be honest with yourself. The fact that we're seeing more cases and we're capturing them is not necessarily a bad thing. This goes a long ways to trying to contain this. We're in a very different place than we were a year ago. Dr. Fitzgerald and her team have more tools, have more evidence, and if we all follow their advice, we will get through this together. Thank you.
Thank you, Premier. Stay safe, everyone. Take care of yourselves and each other, and enjoy the rest of your day.